Hi, we're Group 6, and we will be discussing to you about the Pascual family. Our group consists of April Monsalud, Adjo Abraham, Chu Fang, Erica Tarnate, and Hui Huang. Our presentation includes case scenario, family profile, health, family, social history, present problems and issues, genogram and echo map, therapeutic questions, commendations of family and individual strengths, and family care plan.
Family profile: John, father, 53 years old, work full-time as a forklift driver in a private construction company. Mary, mother, 49 years old, is a full-time housewife. She takes care of the three children, married to John after giving birth to Stella. She has been suffering long-term pain from her rheumatoid arthritis. Stella, eldest, 20 years old, is a first-year student at York University. She works as a part-time job at a coffee shop. Davy, second child, 16 years old, is a grade 10 student and is a member of the baseball team. Tom, youngest, 3 years old. Health, family, social history. John and Mary have been married for 20 years. The family lives in the northern suburbs in Newmarket, Ontario. John works as a forklift driver in a private construction company in downtown Newmarket. His wife, Mary, is a full-time housewife and takes care of the three kids. Mary has a sister and a brother who lives in Philippines. She moved to Canada after her parents passed away. John immigrated to Canada from Philippines when he was 19 years old. His father and mother are both passed away cause of heart failure. All of John's relatives are live in Philippines. Stella is a 20 years old and a grade 1 university student in York University. She works as a part-time to help pay for her tuition fee. Davy, the middle children, who is a grade 10 high school student, also a member of a baseball team. Present problems. John doesn't do exercise and is considered overweight. He has smoke and drink history. One day he got a stroke while walking and was brought to the hospital. Mary has a rheumatoid arthritis disease, sometimes due to the joint pain that she couldn't do most of her house chores and seldom cook for her family. Most of the time, the family just eat microwave food and fast food. Stella doesn't know how to cope with the stress from school and work. She not only needs to pay her tuition fee, but also family living expense. Davy helps his mother to take care of his young brother Tom and does most of the house chores. It is the main reason why he couldn't concentrate in his study.
The first diagram is the genogram of this family, and this one is echo map, the second one. How demonstrate manners to the family. Call each family member by name. Introduce ourselves by telling the patient and family our name and explain our role. Explain the purpose of the interview. Communicate with the family in an empathetic, timely, and sensitive manner. Make sure to thank the family for their input and contribution, and use a positive language to discuss. Provide the culturally safe care. Maintain all commitments to the patient and family. What 5 therapeutic questions you would ask and engage the family in? What are the strategies in promoting health with your family? What are your family strengths and how do you use these strengths to balance and overcome existing problems with your family? Communication is a significant aspect of the health family. How does each member of your family encourage, experience affection, and show appreciation to each other in order to be functional? Does the family have any activities that engage in to be able to coping with the day-to-day problems? How does your religion belief help your retired family coping with the problem? What psychosocial consideration are important to examine for the family? There is a personal and emotional maturity, coping skill, and family hostilities. For the personal and emotional maturity in this case scenario, Mary was affected by the negative events that happened in the family. It affected her role, mood, relationship, and daily routines. However, she still managed to put a priority on the need of her family. Despite all the negative life circumstances that had happened, it's important to consider Mary's emotion and the psychological feeling, and this may lead to emotion breakdown or depression. Hence, an intervention is required on this matter. For the coping skill in this case scenario, John had a stroke and the family role were changed. Mary has to do everything to provide all the needs of the family. David and Stella have to provide supervision to each other. Tom resumed caretaking roles. Mary had to give up activities in order to care for her loved ones. Role change can be difficult, and the family members may find themselves feeling exhausted and resentful about what they have to give up. Also, acknowledge the impact the events on their life. Recognize when they have been triggered and use the coping skill to effectively manage the result emotion. Family hostilities. In this case scenario, Stella found it difficult to cope with a university life and her family crisis. She gave in to the stress and started to smoke to balance the stress, because it is the only way Stella knows how to cope with the stress. This makes Stella experience the hostility from her parents and other family members, and make her feel as if she is far away from being taken care of. Although Stella sought for help and is started to be responsible for the consequences of her action, Stella may be able to regain her strength to face the challenge in her life, instead of smoking as a coping mechanism.
Foundations of family and individual strengths. Family support. We would commend the Father John for being supportive for his family. Awareness of the situation. We would also praise Stella for trying to help her family in their financial needs. Coping up. We applaud David for taking care of his younger brother Tom and helping his mother in doing the house chores. Family values. We would like to point out the family's strength of trying to help one another despite the various issues in health and their lifestyle. Parental duties. We would commend the mother for keeping the family together. How we would write a script of what exactly we would say is, First of all of you are doing a great job of sticking together as any family should. John, you are doing a great job as the head of the family and giving the support that your wife and kids need. Mary, you are also doing a great job for taking care of the kids and raising them with good family values. And it shows because of how your kids take care of each other. All of you are doing a great job, and this is the strength of your family. You just have to continue to take care of each other and set short and long term goals and try to figure it out together as a family and continue to have faith in each other.
Okay, so for our family care plan, our first nursing diagnosis is altered family process related to change in family roles and structure associated with illness and disability of a family member. So for interventions, we want to encourage and assist family members to verbalize feelings about the client's diagnosis and its effects on their lifestyles, family structure, and we want to actively listen to each family member and maintain a non judgmental attitude about feelings shared. So, we want to promote communication and support to the family. We also want to provide privacy so that family members and client can share their feelings with one another. And they want to stress the importance of and facilitate the use of good communication techniques. And our last intervention is to emphasize the need for family members to obtain adequate rest and nutrition and to identify and utilize stress management techniques. The rationale for this is to help them deal with the emotional as well as the physical changes that are being experienced. Next, family care plan, it's an ineffective individual coping related to feelings of guilt and powerlessness as manifested by John being uncooperative and irritable most of the time. For the interventions, we want to encourage John to verbalize feelings of fear, anxiety, and guilt. The rationale for this is to help him begin to come to terms with acceptance of his current health situation. And we want to allow time for John to begin to adjust to the diagnosis and its implications, the planned treatments, and anticipated changes in his lifestyle and roles. So the rationale for this is to help him maintain optimal health by focusing on methods of altering rather than changing his lifestyle. And we also want to include client in planning care, encourage maximum participation in treatment plan, and allow choices when possible. This will enable him to maintain a sense of control and gain self-worth. And last but not the least is ineffective health maintenance related to lack of health-seeking behavior as manifested by Mary's inability to care for her own health. So the interventions for these are, we want to assess the client's feelings of weariness, stress, and worries, and by doing so, the verbalization of feelings will promote communication and support for Mary. And we also want to help Mary determine how to arrange a daily schedule that incorporates her own healthcare regimen, such as consulting a health professional that can help her deal with the stress and as well as the pain that she feels every morning. By doing so, this will help her maintain her own optimal health and while caring for the needs of her family as well. So we also want to refer the client to community agencies for appropriate follow-up care such as day treatment or adult day health program. The rationale for this is increased social support can help reduce stress both physically and emotionally. And last but not least is we want to meet with the client following the proposal actions to review the contract and determine the next course of action. So we want to do this until the client is able to initiate and follow through independently. The rationale for this is the successful completion of contracts promotes improved self-esteem and as well as positive coping. So that's it for the family care plan. Thank you for listening.
Hi there, I'm Arjun. I'm Arjun here. My question is about what tools would you use to engage and support the family? So first one is the family-centered care self-assessment tool. Family-centered care self-assessment tool measures. It increases our outpatient healthcare settings and families' awareness about implementation of family-centered care. It also provides an organized way for healthcare settings to assess current areas of strength and identify areas for growth, plan future efforts, and to track progress. Second one is about the family assessment and intervention model and family system stresses strengths inventory. This another useful tool to assess the family stresses and strength and how we can utilize the family strengths to empower the family and strengthen their relationship. Third one is the family reasoning web template. It is an organizational tool to help cluster the individual pieces of data into meaningful family categories such as family supports and resources, family health knowledge, family stress management, and family routine of daily living. Next one is the family family genogram and echo map. This actually engage families in their own care and provide care providers with visual diagrams of the current family story and situation. The echo map is useful for getting a clear picture of the relationship between an individual family and the world around it. Second question I have is what are your priorities for this family? So first priority is the family health. Each family plays a significant role that is part of the family's everyday function. Disease or illness of one family member disrupts the whole family. The second one is about the income, social class, and structure. Income provides the status to the family in the society. They also give the chance for good education, food, clothing, and housing for the family. If income is not enough, the social and structure of the family is sometimes affected. Talking about the values and tradition. Tradition and values play an important role in shaping a child's personality. They also strengthen the family bond of comfort and security within the family. Next one is the family's nutrition. Healthy nutrition is a crucial aspect of family health promotion and health protection. Major aspects that influence nutritional health are societal trends such as fast food and individual concepts such as age and activity level. So that's about my topic. Thank you so much for listening. Have a wonderful day. Bye.